Hello, everyone. I'm Crystal Azelton, the Director of Space Application Programs at the Secure World Foundation. First, I want to thank you and the panel for joining us today for discussion. This is the fourth in a series called Serving Society with Space Data. When the Secure World Foundation and MIT's Media Lab Space-Enabled Research Group first conceived of these series, we wanted to highlight projects and activities around the world that use space data in new, innovative, and particularly effective ways in efforts to achieve the Sustainable Development Goals. We intentionally chose SDGs that may get less attention in terms of how the data, and especially space data, can be used to plan, implement, and monitor global development and humanitarian projects. So far, we've covered food security, peace, justice, and institutions, and energy. But today's topic of SDG 3, good health and well-being, is now even more urgent and pertinent to all of us. So again, I really want to thank our speakers for taking the time out of what I know are their incredibly busy schedules to share some of the case studies, as well as their thoughts for future opportunities. Before we get started, I do want to share a few housekeeping notes. So we will be doing questions after our speakers have their presentations. We'll be using Slido for that. The code is SDG3. You can see that at the bottom of your live stream screen. And please join us there. That's where we'll be having any discussions, thoughts, questions that we'll be sharing. There'll also be a live poll for you to participate in. I also want to note that we will be having live closed captioning during this event. Just look at the bottom of your screen and you can turn that on if that's something that is of interest to you. So our first speaker will be Mr. Andrew Zolli, who is the Vice President of Global Impact at Planet Labs. Andrew, I'll go ahead and turn it over to you.
Thank you so much, Crystal, and thank you both to the other presenters, to Janet and Philippe, and to everyone who's tuning in. It's a great honor and privilege to be here with all of you today. I'm going to share my screen and take you through a very short presentation. Hold on just a moment, and we'll see if that comes up for everybody. As Crystal noted, my name is Andrew Zolli. I oversee what we call the Global Impact Portfolio, which is the use of Planet's data for accelerating sustainable development, humanitarian response, human rights, and other aspects of our data products and services. Because many of you may not know too much about Planet, I just say one or two things about it. We were founded with a mission to use space to help life on Earth. And we've deployed, we're probably best known for having deployed the largest constellation of Earth-observing satellites in history in a giant ring around the Earth that collectively image the entire terrestrial surface of the planet every day. We do that at roughly 3 meters per pixel. And then we have a very large, in fact, one of the largest constellations of sub-meter very, very high resolution satellites that image at 50 centimeters per pixel that can visit anywhere on the Earth up to 12 times a day, so that we can do very rapid revisit. In fact, we're using those tools right now in the context of the terrible explosion that just happened in Beirut. And the whole premise of this work is to make the invisible visible, because you can't fix what you can't see. And many of the challenges that we confront are ones that have very subtle signals in the world that we have to attend to. So as I mentioned, this is how we do this work. We put these satellites into this specialized ring orbit that goes from the North to the South Pole. As the Earth turns perpendicularly underneath them, those satellites then image everywhere. As you see, that sort of is a line scanner for the planet. Then we take all that data, we download it, we integrate it into a single coherent picture of the Earth, and then we use the tools of machine learning and computer vision to extract meaningful patterns and essential insights from that data set. We combine it with other data sets and build robust industrial scale machine learning and AI tools. In this case, for instance, one of the things we do is we extract all the roads and buildings, not just in one part of the Earth, but everywhere on the Earth. We have the ability to do that. So it turns out that just that singular insight, we're building a generalized system for understanding how change happens on the Earth. But the ability to extract roads and buildings turns out to be absolutely essential. It's essential right now in Beirut, just as an example. We have to move ambulances through the streets, and knowing which streets are blocked or destroyed is of essential importance. It's important if we want to connect rural populations to health centers. And we'll talk more about it in the context of this discussion on SDG 3 about its interconnectivity with other SDGs, including SDG 9, one of the measures of which, one of the indicators of which is the distance between rural populations and an all-season road. Turns out that that's really critically important for connecting people to health infrastructure. We do that work not just in Beverly Hills, but in Bangladesh and in every refugee camp all over the world. Essentially, we do it everywhere, every day. And in an environment where, for instance, we have the forced migration and clustering of people in very close quarters, which are the most significant things we can do to accelerate various disease vectors, whether they're waterborne diseases or other infectious diseases. The ability to look at places like refugee camps and to understand how they're evolving over time turns out to be essential for calibrating our public health responses. Planet does a great deal of work on the SDGs generally. In fact, we've done various independent assessments with ourselves and other independent actors and with the UN itself, and determined that our data is helpful in measuring targets and indicators under 14 of the 17 SDGs across this very wide spectrum, which is helpful because, as I said, there's enormous interconnectivity between the goals. And so there are things that we're doing that are relevant in hunger and agriculture and the food security that are directly relevant to to the ways in which we measure public health, not only keeping people healthy, but also understanding emerging health risks, which we'll talk about in a moment. One of the reasons that this is particularly acutely relevant right now is that if there's a headline on the SDGs generally, in the age of COVID, it's that it's largely shuttered things. If you look at the kind of national government level, 96% of national statistical offices have had their field data collection activities significantly hampered by COVID. In some cases, it's shut it down fully, their ability to collect information in the field. And 9 in 10 of those national governments in low and middle income countries saw, as a consequence, their ability to report on the SDGs significantly impaired. And so in that context, the question is, how do we continue to ensure delivery and that we're paying attention when suddenly we can't get out into the field? And I'll give you just one example of how this is directly relevant to issues of public health. In Congo Brazzaville right now, there is an emerging Ebola outbreak, and there's been anxiety about both primary and secondary outbreak in Congo Brazzaville. There is a place that's very remote. It's not served by roads. It's only accessible by water and by air, called Liranga. And Liranga has a remote food market that only operates every other Thursday. Recently, we were in touch with the World Food Program with a partner to help them identify whether or not in real time the markets were still functioning because of this public health outbreak. So in this case, what you see on the left is a picture of the market on a day when the market was not operating, because it operates every other Thursday. This is a picture of it the following week, and you can actually see on the right boats and people and the sort of normal market activity. We're now helping to monitor infrastructure like this all over the world as a direct consequence both of COVID, but also of the intersection between COVID and other illnesses. So more broadly speaking, how do we think about the relevance of satellite imagery to issues of public health and infectious disease? Well, there are at least 4 primary use cases that are involved directly in the delivery of services around public health for infectious disease. The first one is around modeling the illness. And here we're working with epidemiological modeling organizations all over the world. Geospatial data, because illnesses are so strongly correlated to specific times and places, they cluster in place. The ability to use geospatial data as a key input to epidemiological modeling is a critical factor. It's used very widely. The second area is once you have the model in place that tells you this is how we think the spread of the illness works, then we can begin to monitor in real time. And because Planet's imaging the whole Earth every day, we can monitor on a daily basis, on a continuous basis, where those risk factors for transmission, for importation are changing. Then once we understand where those risk factors are changing, where we see an outbreak, we want to pre-position health assets and health infrastructure. We want to make sure that field teams are working in place. And so we want to guide a precision public health response. And then finally, especially at the level of COVID, where we're looking at pandemic scale issues, we want to be able to monitor for recovery and understand what the signal of recovery actually looks like. And while all of that's happening within a particular illness or a particular category, then there are the interactions between that space and everything else, whether it's food security or disasters. So, we're right now this morning working heavily on the Beirut case, but just as importantly, we're working with actors who are working in East Africa on locust infestation and the impact on the food security system. We're looking at the impact of wildfires and other natural disasters, hurricanes here in the United States, and their impact on COVID sheltering in place rules. There are all kinds of issues around displacement. So again, the world is a complicated place, and having a singular view that allows us to integrate our perspectives on more than one of these boxes at the same time is really essential. So I'm just going to walk you through a couple of examples really precisely, give you a sense of not only what's happening, but what's coming. First of all, we know, as I said before, that geospatial data is enormously important for disease modeling. This is one of our colleagues, Josh Proctor, who's at the Institute for Disease Modeling, which I think is actually becoming part of the Gates Foundation now. And one of the central message of Josh and his colleagues is that this kind of data is enormously valued, particularly when you don't have a lot of other information. So here in the US, we've got health records, we've got mobile data, we've got all kinds of things that we can be using. In some communities, we don't have the same level of information density, and these tools are important proxies when those other forms of information are not available. When it comes to monitoring, I want to give you just a couple of examples. The first thing to say is that if you look at something like COVID, like SARS and MERS, it's a zoonotic illness, which means it spends a significant portion of its life. In fact, it's a novel coronavirus because we think it was in bats and had not appeared in human beings before and was transmitted. Now, understanding how zoonotic illnesses are spread goes directly to how human beings think about and interact with the landscape. So one of the things to note here is that while we tend to think about COVID as a public health crisis and as an economic crisis, it is foundationally an ecological crisis. It's a crisis of the relationship between human beings and the environment around them. More than a third of the world's land are now cultivated for livestock and agriculture, and that's out of 75% of the land that human beings have transformed for our own purposes. That's putting enormous pressure on biodiversity hotspots and on wildlife habitats. That's increasing the interactions between wildlife, human beings, and livestock, and increasing the chances that we will get these kinds of novel viruses that spread from wildlife to humans, and in reverse as well. That's why organizations like the folks at Gavi say if you want to understand where the next significant pandemic might come from, or the next major public health crisis or virus, you have to look at where the land is changing and where human beings are changing the land. In fact, actually, that's a big part of what we're doing is biosurveillance now, is looking at places where human beings are changing the land in a fairly uncontrolled way. What I'm showing you here is a quick animation of deforestation deep in the Amazon. What most of you will see is sped up over a few months, just so you can see it spread across the landscape, mostly on the right. What you might not have noticed is on the left, after that deforestation occurs, there's a set of spidery tendrils that emerge. Those are the illegal logging roads that are put in before the next round of deforestation occurs. And because we can surveil those things with efficiency, we can understand where do we want to deploy people, public health actors and field workers, to make sure that we're monitoring for a potential emerging infectious disease. We're taking that idea of monitoring and actually using it in a number of other cases, which are quite similar. One of the most significant partnerships we have is with a group called the End Fund, and specifically a part of the End Fund called the Reaching the Last Mile Fund. The End Fund focuses extensively on neglected tropical diseases. And these are diseases that are diseases of poverty. They largely cluster around the tropical belt of the planet. They affect people, particularly in remote communities where there often is a lack of public health infrastructure. And some of these illnesses, like river blindness is a good example, are transmitted by parasite only when, because those parasites attach to black flies, only when those black flies are gestating and reproducing. And they reproduce in fast-moving water. Well, it turns out that we can actually monitor all of that fast-moving water, all of those riverine systems for activity, so that we can understand precisely when we want to deploy people and precisely where we want to deploy people with these sort of public health campaigns. So for example, with them, I'm going to show you just some what looks like fairly unanalyzed imagery. This is a special index called an NDWI index. It's a water index. We're looking here in a place called Niger, and what you see here is a settlement on the screen of people near a dam, but upstream, fed by the river that feeds this dam. Here you can see when is it flowing and when is it not. This is in January of 2019. This is in March, and you can see, just as I flick between the two, precisely when those input streams are running, and that's exactly when and where you want to deploy human beings. So we're beginning to think about how we use these kinds of tools to deliver greater precision. The last example I'm going to give you, and then I'm so excited to hear from our colleagues on this webinar this morning, is work we're doing with a couple of really extraordinary organizations. One's called ACROS, which is based in South Africa and Zambia, and the other one is a group called Locational. We're all working together, particularly to accelerate vaccine and universal health delivery, universal healthcare coverage. In a couple of countries. We're going to start in Zambia and Senegal. And the intention here is to use satellite imagery, AI, and machine learning, and mobile devices, mobile tools, to accelerate the ways in which public health workers can deliver work in the field. And we're doing that now in some of these other target illness areas so that we can be collecting the information to accelerate a COVID vaccine and therapeutics when they are available. They're not available yet, but there's a lot we can do now to ensure that when those vaccines are available, when those therapeutics are available, that we can deploy them as quickly as possible. Now, this work begins with very high resolution satellite imagery. This is a picture on the left of a standard, what we call a SkySat scene. This is one of those 50-centimeter images. And you can see how detailed it is. We get right down to the individual household level. We work with this organization, ACROS and Reveal, and what they produce is a tool, a digital tool on tablets and mobile devices, in which specialized workers working with machine learning tools annotate the imagery to determine where households are, particularly in remote areas. So because we have the ability to image in very remote areas everywhere on the earth, we can then give that data to these annotators, who then mark it up in a way that helps guide people in the field. Now, the thing that's exciting about that is that that data then can flow back to help us improve some other aspects of the system, which I'll describe in a moment. The most important thing here is to ensure that absolutely nobody is missed. And especially in a COVID context, you really want to make sure that we're prioritizing everyone who needs to be prioritized, and we don't miss anybody. Using this tool in just a malarial context, we've seen that compared to just delivering indoor residual sprays, it delivers a significant outcome, a significant improvement over kind of baseline mechanisms by which we treat malaria and reduce the risk of malaria. And we're lowering the cost as well. So this is about delivering what we call precision public health. The other part of this is the other partner in this effort is an organization called Locational, and this is a group of spatial epidemiologists. They spun out of University of California, San Francisco, and what they're doing is taking all of this data and producing dynamic risk maps that show us where the disease is spreading, overlaid with the spatial data, And that allows us to prioritize which places in the community get hit first. So in terms of an outreach. So here you have a particular area. This is where we know these are all the residential buildings. Here we have an overview of where the caseload is highest based on sampling, and that tells us these buildings here on the right are the ones that need to get delivered to first, need to be visited first. The reason that's interesting is we're starting to see this sort of flywheel effect as we begin to spin this work up, where the satellite imagery guides the people in the field who are doing the work. As they do the work, are producing additional data, which is then fed back to these epidemiological models, which improve the models. So the models guide the humans, and then the humans improve the models, and you get this sort of beautiful reciprocal back and forth between these systems. So we're going to see a lot of these tools come together, the sort of machine learning and statistical analysis and epidemiological modeling tools, the front end mobile tools, and then fed by this real-time satellite imagery. We're going to need to do this not just in a few countries, though we're starting at scale in a few countries now, but over the course of the next few years, we're going to need it basically everywhere. And so this is really the beginning of a much larger story. Anyway, with that, I say thank you very much. I'll hand it back to Crystal now, but we're really looking forward to hearing from everyone else.
Great, thank you so much, Andrew. That was really a fantastic overview, not just of the work that Planet is doing, but really some of the scope and variety that we see across SDG 3. So I really appreciate that. It was also the perfect lead-in for our next speaker, who's going to talk a little bit more in depth about the type of work that you ended on. And so I'm really pleased to introduce Ms. Janet Zhou, who is the Deputy Director of Strategy, Planning, and Management at this Bill and Melinda Gates Foundation. Janet?
Hi, good morning, everyone. Thank you so much for having me. I lead the strategy and operations for a number of programs in our Global Health division, and I'm here actually representing the excellent work of our grantee Grid 3 and my colleagues in Siemens. Crystal, are you going to put up the slides? I think. And so I actually want to pick up, you can go to the next one. I want to really emphasize actually exactly what we just heard from Andrew, which is that there are 17 SDGs, and we're here to talk about one of them, SDG 3, but these goals don't really exist in isolation. Health and wellness is just as dependent on SDG 2, which is about hunger, as it is on SDG 5, gender equality. We know that malnutrition is one of the biggest risk factors for mortality, and it affects the efficacy of our vaccines. And most health workers and caretakers are women, and I could give that example for pretty much any of these goals around the wheel here. And so if you go ahead and click, the example I'm going to tell you about today is very specific. So we're kind of going from the variety of cases that Andrew told us about into one very specific one. And it is about the case of geospatial data to accelerate polio eradication. But I don't think it's too bold to say that geospatial data is really a global public good. And it underpins pretty much everything we do in SDG 3 and in some ways all of the SDGs. And what you'll see in our polio example is what we desperately needed was a better way to estimate the size and distribution of the population. And getting that kind of geospatial demographic data is really essential to planning everything that we do and that we touch in SDG 3. If you go to the next slide, what I'll do is I'll zoom in on polio and tell you that polio has been a scourge for about as long as humans have been around. So the picture that you see in the upper left here, it's dated from around 1580 BC. It shows an Egyptian priest with a withered leg, and that is a canonical mark of the polio virus. We made a really big advance in the fight against polio when Albert Sabin developed the oral poliovirus vaccine in 1961. You can see that in the lower left-hand corner here. But eradication doesn't come onto the global agenda until 1988, and that's when the World Health Assembly made its call. And in the graph on the right, you can see that's around the time that immunization rates, which is what you're seeing in those blue and red lines, start going up. And for most people in most of the world, that is around the time that polio becomes a memory. But our story today is about Nigeria and how it stands out its last case of wild polio virus in 2014. Next slide, please. So executing eradication campaigns requires two basic inputs. It requires an understanding of epidemiology, and it requires access to resources. And it's perhaps no, I think, accident that in some of the cases that you heard Andrew talk about, it was also around some of these neglected tropical diseases. And in part, that's because when you get down to eradication, you need a lot of precision. And you need precision because the epidemiology is happening in very precise locations and places. And so, Crystal, if you go to the next one, what we know is that we can eliminate poliovirus provided we get enough vaccine into the right places. And in our case, enough is 80% coverage, and the right place is actually defined by LGAs. And in the map here in Nigeria, those LGAs are the lines inside each of the color blocks. And there are more than 700 of them, and they're similar to kind of US Census Tract administrative boundaries. Go ahead and click. We're making progress in Nigeria. You can kind of see here where in 2013 and 2014, there's sort of a steady increase in those green bars. And when we get those green bars above that orange line, that's when we've achieved 80% coverage in high-risk LGAs. And for our story, we really need to understand what is comprised of that orange line. So go ahead and click. So coverage is actually very simple. It's the number of people vaccinated over the number of people that are eligible for vaccination. And if you go ahead and click one more time, what I'll tell you is that though that's a simple equation, it's actually not simple to execute at all. It takes a tremendous amount of heart. The picture that you see there is something I could show you a dozen more of, and these are vaccinators that could easily be contestants on American Ninja Warriors, because it's no accident that the last places the disease chooses to hide tends to be the places that are the most remote, the most poor, the most forgotten, and getting vaccines to these places requires a tremendous dedication. One more, click one more. It also, it turns out, takes a lot of money, and critically, how much money you need actually depends on how many people you think you need to reach, which is that denominator there. Go ahead and click one more time. As it turns out, estimating the number of people who need a vaccine is harder than you might think, and there are a number of forces that drive that. Click once. The first is that doing a census is expensive, and so it's done infrequently. Nigeria hasn't had one since 2006. They keep trying to have another one. It keeps getting delayed. And then, of course, what that means is by 2014, you are stuck using the UN's 2.1% annual growth rate to estimate how many kids you need to vaccinate. Click. One reason that the census keeps getting delayed is that it's actually extremely political. It's the basis on which votes and social services are distributed. So even if you could get a census, you might be wise to suspect its veracity. Click. And it turns out that satellite images are a cheap, real-time, and tamper-proof way to get updated population estimates and where those people are living. So it gives you sort of a spatial sense of the distribution of people. Click. And then even better, what they do is they can provide you with maps that have more accurate boundaries for planning campaigns so that you're not missing people who live on the edges of these administrative areas because one vaccinator team thought that this household actually lived in a different administrative area was going to be covered by a different vaccination team. So the top picture that you see is actually what most polio vaccinators are working off of. You can see it's a hand-drawn map with kind of symbols of where they think houses are, and the bottom is a satellite image with the administrative boundary overlaid. And if you could zoom in, you could see that there are little dots representing where actual houses are. Go ahead and advance to the next slide. So a little bit of intuition on actually how this works. It starts with extracting settlement imagery, high resolution. In our case, it was 3-band worldview 2 imagery from Digital Globe for Kano State. 37 images, strips were extracted, and they were put through a supervised machine learning classifier to determine different neighborhood types. Once we had those neighborhood types, we deployed a microcensus to collect actual population counts for each of those neighborhood types. In our Kano case, that was done by eHealth Africa. It was a local NGO that also administered vaccines while they were counting people. That microcensus data then, along with the classified neighborhood rosters, get combined into a population density algorithm that predicts the population count for every 90 meters based on the satellite image. So in number 4, if you could zoom in, you would be able to see that there's, go back. You can see on number 4, there's sort of a grid, and you might be able to see that it looks like little white numbers. And what those little white numbers are is an estimate of the number of people that are living in that 90-meter area based on the satellite image and the extrapolated microcensus data. So that brown patch that you see, you would have zeros over. And then if you go over to the right, you see there's an area that looks like it's gray, and that's a slum. And the numbers that are in that area are 300 to 400 for every 90-meter square. And finally, all of that gets ported into a planning interface where you can layer in additional information such as travel routes for the vaccinators, completion rates for planned campaigns. So click to the next slide. What you will see here is actually what the net result of all that work is. And you can see how our satellite-based estimates compare with the flat census extrapolated population estimates for Kano State in Nigeria. And the left is what the satellite images predicted the population growth rate had been between 2006 to 2014. And on the right, if you had sort of used the UN estimates, you would have had to assume sort of a 17% flat increase in population over the whole area. And if you click once, what you'll see is the comparison between what our satellite images predicted in each of those LGAs versus that 17% flat. And you can pretty much see in everywhere, the satellites estimated that there were more people than that 17% would have. And in particular, actually, that discrepancy is most stark in the outer exurban areas. And what that tells us is that if we had actually planned the polio campaigns in Kano using the census estimates, that 17%, we would have had to use that 17% to estimate how many vaccines we need, where to send vaccinators. It would have been very unlikely that we could have reached that 80% of the true population to interrupt transmission. And even if we had met that 80% goal nominally, we probably would have seen polio transmission continuing because that 80% was off of the wrong population base. And what satellite images allowed us to do was both in total quantity, but also in the distribution of people, really improve our ability to plan campaigns and ensure that we were going to get to a coverage level that could actually break virus transmission. So go ahead and click. Nigeria did use these satellite-based population estimates and GIS mapping to plan their polio campaigns in 2014 and 2013, and they were actually successful at interrupting wild polio virus transmission in 2014. It's hard to say if it could have been done without satellites. I think a lot of things had to go right for this to happen, but I'll leave you with just sort of one jaw-dropping indication of the counterfactual. Go ahead and click. In 2014, the Global Polio Eradication Initiative did a scenario analysis to determine how much of the remaining job of eradication would cost under different assumptions. And you can see actually that the major driver between the scenarios has to do with when different countries achieve that interruption of transmission. And that's because you can reduce the number of vaccination campaigns dramatically once that interruption has been achieved. If you compare scenario 3 and scenario 4, the only difference there is the date of when Nigeria interrupts transmission. 2014 is when it actually happened. 2015 is what we were worried about if we didn't accomplish what we did in 2014. And if you look at what that represents below, that's a $1 billion difference in the total cost of eradication. And so while undoubtedly many factors contributed to that achievement, it's fair to say that satellite-based population estimates certainly played its part in saving the global community at least $1 billion by helping Nigeria improve the precision and efficiency of its 2014 campaign. So last slide here, if you click one more time, having better population estimates is useful not just for polio, it's pretty much useful for planning every health and social service intervention we work on. We have examples as diverse as measles campaigns, mapping the movement of people, to identifying the existence of rapid informal settlements of refugees. If you want to learn more, I really encourage you to check out Grid 3. It's a multi-sectoral partnership. It collects geospatial reference data, links that to population and demographics modeling, and supports data management and use across all sectors. And finally, thank you to my colleague, Finn Seaman, whose work a lot of I profiled here. So back over to you, Crystal.
Thank you so much, Janet. It's so useful to me to really dig a little bit deeper than we sometimes see into exactly how this works and what it looks like and how it can be useful for a variety of actors in a variety of ways. So thank you so much. I'm really looking forward to your question and answer session to learn more about your work at the Gates Foundation. Our last speaker today is Philip Mandarino, who is a geographer and a city information coordinator at Piero Passos Institute in Rio de Janeiro. Philippe?
Hi, everyone. Hi, Crystal. Thanks for the invitation. It's a pleasure to join and a challenge to talk after Andrew and Janet. I've tried to make this presentation as if I was telling you guys a story, which is basically what it is. And many of you might be thinking what a local government from Brazil is doing in such a webinar or with space technology. And this story, obviously, we always worked with remote sensing and satellite images, but this deeper story begins in 2015, when we developed a partnership agreement with NASA, and which is really based in bridging the gap that we know that exists between space technology, Earth observation, its global data sets and models, and the challenges and the ultra local also challenges and data that we have in the local scale, in the city scale. So recently we released this article where we discuss this work that we have been doing with Rio, and there is also a nice example from the city of Chicago in the US, working with air quality. So this is quite a unique partnership, and we are now working to extend it for more 5 years. So we started in December 2015 for 5 years, and now we are going to extend it for more 5 years, which I imagine is a good show of the success of this initiative. So next slide, please. So what we can talk more directly about our work related to the SDG 3, which is the SDGs are really underlying much of the work we are doing in the city government currently. I will explain that in the end. So you can see in your screen one of the SDG 3 targets, which is related to pollution as a whole. And you can see in your screen a video showing a small part of our work with air quality forecasts in Rio de Janeiro. So NASA has this new global chemical model developed by them in the GMAO office. And what we were looking at these models, it has a 25 kilometers grid spatial resolution. For a city complex like Rio, it was not that accurate. We have a complex topography, for example, several things that make the model hard to run in this scale for the city. What we did was exchanging local data with the colleagues at NASA, and they used the machine learning process to make the model better understand the behavior of air quality throughout the city. And then now we have adjusted an adjusted version of this model for the city, and we can inform people and hospitals, for example, in hazardous air quality conditions in advance. So we can have like a early warning for air quality conditions in Rio. Next one, please. Other direct example regarding people's health and our work is we recently gave this interview to Science. It's this work in landslide modeling. It's one of the main, or I would say the main natural, we can maybe not use the word natural regarding disasters in this case. It's one of the main disasters that we have in the city of Rio, with a long history of fatalities, economic impacts, but also work of the city to deal with that challenge. It's one of the, I guess, only cities in Brazil that has a geotechnical foundation, for example. So we are using this global landslide model that NASA developed, and we did it run in a local version in Rio for operational use. So it's the first place in the world that has operational use of this global model that NASA developed for landslides. And next one, please. And then enters our collaboration with MIT, which is basically a direct consequence of our partnership with NASA. Daniel Wood, several of you might know, the head of the Space Enabled Lab, used to work at NASA, used to follow our partnership, and then invited us to also collaborate with the Space Enabled Lab. And we have been doing that since 2018. It's a great pleasure. Our current project, that we started work with was over using complex system modeling approaches regarding mangrove ecosystems in the city of Rio, its societal impacts, economic use of the mangrove, and also they all have this like loop of what the model is able to generate, what it's not, what are the gaps, and what we should design of technology to close those gaps in the future, and this will feed the model and so on. So this is the work we have been developing with Jack Reed as part of his PhD thesis, and also a local university here in Rio de Janeiro, UFRJ. So next one, please. And then enters the COVID-19 pandemic, which is, I guess, one of the greatest challenges we have faced in the last years and decades. And it's not only a health challenge, of course, but it is, of course, also a public health challenge. And in the city of Rio, we have been doing several data analysis. And for example, this dashboard was released in March when we started having local transmission in the city. It's inspired in the Johns Hopkins dashboard, which is world famous. And it has now more than 3 million page views in this last month. Next one, please. We also have been working with several other dashboards, data analysis. You can see here a heat map of suspected cases of COVID-19. We are dividing these through the epidemiologic weeks. We also have a dashboard to monitor hospital beds, uses, and planning, several initiatives. And we have had the opportunity to present this to Danielle and her team at MIT. And next one, please. We are working now with them as one of the pilot cities for what we're calling the Vida Decision Support System. You can see it's based on a similar approach as the model I briefly presented about mangrove ecosystems. You have a complex system modeled with different subsets, model subsets. Public health, you have an environmental model, you have a socio-economic model, a public sector decision-making model, and you can also have the technology design model in a loop with the rest of the models. All of them interact. I want to show a quick example in the left below corner. In the left lower corner, you can see an image with planets, data that we use it to estimate if there were cars in parking lots in the city as an indirect measure of social distancing, for example. In the right, you can see an image. We were trying to assess what is the impact of the social distancing measures in the water quality. Not necessarily that we would have a better water quality because, well, people, we still have our problems with sanitation and so on. But if we would have a different spatial distribution of the water quality in the Rio, since people in downtown, well, there wouldn't be so many people in downtown. People would be more in their residential areas, and we could find some interesting results. But those were there are also some environmental factors involving this phenomenon. So we are still trying to study better what is the role of the social distancing in these changes we have been seeing through satellite imagery in the city. There's a lot. We are working now also with COVID. We are working with NASA also regarding air quality and trying to monitor what is the air quality impact of social distancing in Rio comparing to other cities. which is also quite interesting. And next slide, please. I guess only to close, it's too much to say, but I would like to close saying that the city is currently developing its sustainable development plan. Our logo is the image on the left. And it's one of the few cities that, with the support of C40 Cities, is developing this plan based on the SDG agenda and also in the Paris Agreement agenda. So this is a really good potential on doing work on both fronts, which are closely connected, of course, and decreasing inequality is what will get us there anyway. And we have a huge challenge now in the recovery from the COVID-19 pandemic, and there are also opportunities, of course. So thanks for your time. I will be here for the discussion and clarify anything that was not clear, if it is the case. Thanks.
Thank you so much, Philippe. It's so inspiring to see just the real-time nature of this work. It's often easy to conceptualize these as long-term projects, and often they are. But at the same time, this is as Andrew mentioned in his presentation, and you just gave us all of these examples, this is also figuring out how to use data right away and to put it into place to affect people's lives today, tomorrow, and immediately in the future. What I'd like to do now is turn to the questions. And so invite everyone online who's listening in to join the conversation. Just go to Slido. The code is SDG3. That'll take you to our event. There's also a poll that you can fill out, and we'll have the speakers comment on that as well. I'd like to get us started with kind of a question to each of the speakers. And Philippe, I'm just going to turn it immediately back to you. So in times of crisis, and even just in longer term health issues, decision makers often need and want new data, but they might be limited in their ability to train or to gain understanding and access to data. Can you share how you've been working to overcome this limitation and make sure that the data that you're putting together is immediately actionable by non-geospatial professionals?
Thanks a lot. That's a great question and gives me the opportunity to explain a little bit of my role within the city government. So we are an institute based within the city government. Our main role is to be like the data hub, data information knowledge hub for the city government, but also for other entities which work with the city. And we run what we call the CURB. It's the Municipal Urban Information System of the city. And it's, for example, where we build those dashboards for COVID-19 information. So we have a team that is used already to have this role of getting complex information and making it more usable, understandable for a wider audience, not only within the city, but also for data.rio, which is our open data portal, also managed by us, with everything that can be made public from CURB, which is basic, almost everything. We put it available at data.rio, which is, as I said, our open data portal. The training, the capacity is a challenge. We are working with really complex information in some of these projects, as you could see, and we rely a lot on partners and local universities and also international partners, as NASA and MIT. We have been doing, for example, RSAT trainings from NASA, and we ourselves at IPP offer training for other city entities that are interested in using geospatial information in their daily routine, and that has been quite an interesting effort, and with quite interesting results. We have nowadays, for example, in the health department of the city, very advanced users of geospatial information, which are developing with us or by themselves awesome dashboards to analyze and provide data regarding the COVID-19 pandemic, for example.
Great, thank you so much. I'd like to turn now to Janet and really dig a little bit more. As a global health professional, you're representative of an organization whose mission is much broader than this topic. And I was just wondering if you could provide insight into how to effectively, efficiently, appropriately expand the use of Earth observation data in new ways for public health? You know, where do you see the field evolving? How did Gates Foundation, for instance, get interested in using this data? You know, how can we encourage other organizations to explore the same ideas?
Yeah, no, I think it's a great question, and I'll sort of start it by saying the case example I walked you through in 2014. At that time, when we were using this technology, felt like it was really quite novel, and it has been amazing to see in the last 6 years sort of what has opened up with regards to this technology and the possibilities. And many of the examples that Andrew walked you through, I think, are now sort of accepted conventional wisdom in public health. And it was not the case in 2014. I think in 2014, we were really a little bit out there on a limb saying, hey, maybe satellites can help sort of estimate population sizes. And the places where, and I think I alluded to it a bit, the places where, you know, maybe one mental model that's helpful to think about is satellite images help a lot when what you need is precision. And it is this concept of precision public health. And it gives you precision in a way that still in some sense protects privacy. So there's other ways to get precision via mobile phone data, for example. And that I think at times can be rife for sort of more challenges. Satellite images give you precision at sort of a geospatial unit that's relevant to think about for planning health delivery and health services. And that precision matters in some public health contexts and not in others. And so it's perhaps not that surprising that a lot of the examples that you've heard Andrew and I talk about have something to do with this idea of eradicating or eliminating a disease. So the malaria example that Andrew used is for insecticide residual spraying, and our malaria team has a big focus on what they call either molecular surveillance or also kind of just precision public health. How do you take a limited set of resources and deploy it in the most optimal way so that you achieve the maximal benefit? And a lot of times satellite images can help with the guiding of that precision to sort of say, these are the areas of highest need and these are the areas of lowest need. So if you need to start somewhere, start in the places of highest need. Another area that we've used it for malaria is on mapping sources and sinks of transmission. So understanding how people move, so that we can identify there's some places that are more likely, especially with sort of migrant laborers, some times of year and some places that are more likely to be sources of transmission, so that you can actually concentrate a lot of your resources and interventions in those areas first. Because if you get rid of sort of the volume of virus, or in the case of malaria, the volume of sort of parasites in those areas first, you actually have a disproportionate benefit across the whole network. Some of the other areas that we are starting to use now is around kind of COVID vulnerability mapping. So that's something I encourage you to, one of our grantees, Sergo Foundation, has developed a COVID-19 vulnerability map. And they use geospatial data, but really combining that geospatial data with other data that they have. And I think it's the combination and sort of the multidimensionality that we're starting to get with the data that can really deliver on this promise of, you know, helping us guide and direct what is sort of a scarce set of resources towards problems that are big and hairy and difficult to tackle.
Great, thank you so much. Yeah, you know, when we were putting this together, I was looking at a variety of different examples, and a lot of them do focus on disease. Some of them focus on general health services. I mean, there's a lot of really interesting work being done. I'm a member of the group on Earth observations. They have a working group on health. In some ways, this isn't a new idea. And as you said, in other ways, it's developed quite rapidly in a relatively short time. And while that's exciting, it also means that there's a lot of learning to do for various groups to really understand what this means for work that they've been doing for a long time. I mean, health work is not new, but trying to apply this kind of data is much newer. So thank you for your insights there. I'd like to ask a question to Andrew now. When you and I were talking before, we were talking about like connectivity between different SDGs, and Janet and yourself both mentioned that in your presentations, and Philippe certainly identified several areas of overlap. One area that stood out to us was human rights and the connection between work on health and work on human rights. And I'm really excited to hear what your thoughts on this are, because, you know, projects in the field often overlap. The SDGs are a framework. They were something that was designed to push the world towards action in a variety of ways. But the people that work in these areas, as I kind of just said, have been doing this a long time. And so they don't necessarily bucket themselves perfectly into the SDGs. So I'd love to hear your thoughts on that.
Hi. Sorry, I just unmuted myself. It's a great question. Thank you, Crystal. And I think in many ways it's a great follow-up to what some of the things that Janet was just discussing. You know, the first thing to say is we have those of us who produce very powerful tools, and you know, it's axiomatic that information is power, and therefore big information is potentially big power. And the way you use that information can either enfranchise or disenfranchise communities. This involves, but is not limited to, the ways in which you protect privacy, and goes, I think, more deeply to questions of social equity. So, you know, our first duty of care is to make sure that the extraordinarily limited public health assets that we have, given the variety of both diseases and other factors that we have to cover, are deployed with maximal effect. And so enabling the formal public health system to be efficient and effective, to be transparent, and democratically accountable is all critically important. But if we just stop there, and we must do that as a first action, because that is the literal mechanism by which people are going to receive most of these public health interventions. If we stop there, however, I think we may not go far enough, in part because I really sort of start by saying there's a few sort of philosophical things that are part of what we might call our sort of theory of change around precision public health. The first one is an ethic of subsidiarity. That is to say, to get the solution as close to the problem involves typically involving the people who are closest to the problem. And that means that ensuring that everybody, but particularly those people who are being served, have voice in the process. So that's a critical human rights issue. And it goes to issues of social power. It goes to issues of inclusion. The second thing to say is that, you know, health access, and you see it really clearly in the COVID case, this is not an equal opportunity a virus. This illuminates the health disparities, the levels of variations in social power, in civic power. It illuminates core inequities and core fragilities that we have allowed to fester for generations. And so I think beyond the scope of having a kind of preferential option for those who are most vulnerable, who are often the poorest and most disenfranchised from the formal system, and including them in the solution, we also, beyond ensuring that people are protected and get well, we also want to be able to use these interventions to help improve the situation that we found. In part because we've all had a role in one way or another tacitly creating this situation. So, you know, I do think that the theory of change is to work through the big formal system, but it's also to work as directly as possible with communities. And in order to do so, you have to do what Philippe was talking about, which is you have to take very complex pieces of information and you have to sort of reduce their shape to the most simple, the most accessible, the most understandable, so that people can consume them and use them and advocate for themselves in this in the system. And we're working now with organizations working with a number of indigenous communities directly, and we see deep interactions between issues of human rights abuse, issues of incursion into communities, and issues of COVID transmission. And I could give you lots of examples, but rather than go into the details, just to say that you know, while we're working through the World Health Organization level, and we must also work sort of at the other end of the telescope if we want to build a response that is not just effective, but also socially just.
Great, thank you for that. It touches on some of the questions that I'm seeing roll in from our participants. And so I want to shift over and I'm going to go ahead and share the Slido that we have. In just a second. Here we go. And so I want to encourage everyone to take a look at the questions and to submit your questions to participate in our poll. I'm going to go ahead and start with a question that came in, and I want to just sort of ask this to everyone because I think it's relevant to all three of our speakers. How do we ensure open, equitable access to high quality imagery for those seeking to use EO images for fieldwork and public health workers? Philippe, why don't you go ahead and start? How do people get access to this data? How does that work for you? How do we make sure that this analysis and information is widely available to everyone who can use it?
Thanks, Crystal. I guess, well, the first, there are the technical challenges always, of course, sometimes the budget challenges, some of this information is not free. But I guess everything has to start with a good open data policy, transparency, mainly when you are working in government, in the government sector, as I am. So, and that's what we do at IPP. That's why we were on the city open data portal, for example, at data.rio. It can be challenging to acquire commercial imagery, but for example, with partners such as MIT, we have been able to work with Planet Imagery. In the very quick example I showed in my slide. And always, of course, there are the open source and free information from sources like the European Space Agency, the Sentinel Project, NASA, and other space agencies such as INPE in Brazil, which also has important data sources for ourselves. I guess this is, the approach I could give, mainly focusing the importance of having open data policy and transparency from anyone who is involved in this kind of effort.
Great, thank you. Andrew, what are your thoughts on data access? I mean, some people really cite this as the biggest problem we have, and other people say that it's not. How does Planet view this? You're on mute, hold on.
Sorry, I was muted. Yeah, it's a really good question, and it's a complicated answer. The first thing to say is there's, setting aside any parochial interest from our organization, there are many data sources that cannot and should not be made open, and that by definition are going to be privileged and protected and need that kind of protection. The second thing is that just as an ecosystem, much of the most valuable data is going to reside in private hands. Not, again, setting aside the fact that Planet is itself a private sector organization, if we just look at all of the organizations that have data in the world that's relevant, much of it's going to sit in commercial hands and likely is not going to be open. But that said, we, first of all, our fundamental, Planet was founded as a mission-led enterprise. And so one of the foundational things that we try to do is ensure that price does not act as an impediment. There are 2 or 3 ways we do that. One is we produce digital public goods in which we work with philanthropic partners to take a very sizable chunk of data and we make it available for nonprofit and non-commercial purposes as a general public good, or we make derivatives of that work available as a general public good. So we're often producing subsidized open data, working with the global philanthropic community in specific verticals, whether that's in conservation or public health or human rights. A second category is just the mechanics of the technology. Planet has taken orders of magnitude out of the cost of satellite imagery by shrinking these technologies, making them both technologically efficient and making them financially proficient. And that allows us to reduce the cost really dramatically. And just to give you a sense, a typical satellite task for an image, for an image of an under 1 meter image, when I started working in this field was, measured in the tens of thousands of dollars. Now it's available for about $300. And that is a huge shift and makes it available to many more people, makes this instrument available to many more people. And then I think the third thing is to come up with mechanisms and subsidized structures that allow for lots of actors to work together around a particular problem set. And so, in certain instances, we are enabling a whole bunch of actors. And just as a very typical example, as many of the people on the call will know, we just had this terrible event that happened in Beirut. There is something called the International Charter for Space and Major Disasters. It's all the governments who hold space assets. When a major event occurs, they flag the charter, and organizations, typically national governments that have data, will make it available for free, or will speed or expedite its delivery to those institutions that are closest to the problem. Planet was the first private sector commercial actor to join that otherwise entirely governmental body, primarily because in those circumstances, we want to make sure that the data is flowing and freely so. So, I think the answer is it's a blend, and I think that the answers you'd get from any organization that cares about these kinds of questions will ultimately sort of approximate the same thing. We will have times when we give stuff away for free. We have times when we give stuff away for almost free. And then the last thing I'll say is that we want organizations to be able to embed this kind of data into their operational models, and we want them to value it and to build systems and processes around it. And therefore, we'd like to see these organizations, some of them, budget for it so that they can take it seriously, because you value things that you are invested in. And so not just giving it away, although we do a lot of that, we also want to see a kind of shift in the way that these organizations operate so that they become more data-centric over time. And we hope this approach helps.
Janet, what are your thoughts on this? And we've got some other questions coming in saying, is it harder for small organizations or large organizations? How does your organization approach acquiring the data and sharing that data with your partners?
Yeah, so it's a fraught area. There's no easy answers. I think the Foundation's philosophy at sort of a really macro level is we're willing to pay for the data, but we would like it such that something that we pay for can be utilized by multi-sector actors. And so there isn't sort of the sense of, we paid for it once and then we kind of keep paying for the same data over and over again. But at the same time, I think we are also have worked for long enough in public health and across a number of areas to know that these solutions are always multi-sectoral solutions, that sort of private actors that are innovating and reducing the cost of these technologies, as Andrew mentioned, that's a really important role, and there has to be a business model there. And if there isn't a business model, then we are going to be stuck with the same technology that we've had for decades old. And so our role really is to think through, in many ways, how do we kind of set up an infrastructure and a partnership that sort of allows each part of the sector to sort of act in accordance with their own incentives, but still sort of come through with the public good that's useful to everybody. And so Grid 3, which I had mentioned, and then another, which I will, is called WorldPop. WorldPop is an organization that we fund and that a number of our programs utilize. And the premise is when sort of imagery has been acquired and when analytics has been run on top of it, that those data sets, through sort of the data access sharing agreements that we've made via sort of what we've acquired, are actually made publicly available. And so there are sort of both commercial arrangements that we can make so that when we buy something, we say, okay, the analytics that we do on top of it, we are going to make this publicly available through our partners. That's sort of one arrangement that we do. And we also fund entities like WorldPop that then host that data, add visualization on top of it, and enable sort of people to search and utilize these data sets for their own purposes. That, I think, is in some ways the simple part. The harder part, I think, was one of the questions that you had asked, Philippe, around how do you have capacity to actually analyze and utilize the data? And that's a difficult problem. It is one that I think we in the philanthropic sector struggle with. Certainly, we want to work with in-country partners and make sure that the questions that we're answering. And so in that Nigeria example, we had a memorandum of understanding with Kano State. And we worked on that memorandum of understanding to sort of assess for them what are the different actors that we were funding, what were they doing, how do we support them. But there is, I think, always a need for training and capacity building. And I think we, I think at the foundation struggle with one of the quotes that I think we sometimes say is, sometimes there are $1 trillion problems and we're a $1 billion foundation. And it sounds ridiculous to say because $1 billion is so much, but actually health system strengthening, capacity building, these are $1 trillion problems, and not smartly deploying resources in a way that kind of maximize where they can be best utilized, and that the entity that is best positioned to actually make those investments is the one making it. And so, we work through different channels, and in that kind of instance around capacity building, we work with organizations like the World Bank, which is, of course, responsible for making loans that then countries can draw upon in order to invest in their own health infrastructure. And so that there are other avenues for it, but these are long roads. I mean, these are problems that have, as Andrew said, persisted long before us and will persist long beyond us. It is, I think, our duty of care to understand that they exist and that they are sort of wrapped up in these questions of equitable access and who gets to utilize these resources. I think critically for us, it's very important that when we make these kinds of investments, that the people we are trying to help are asking for this data and asking for this analysis, and that they are really in the driver's seat to take the work forward, because we've seen that sustainability is really a primary challenge, and having a solution that's kind of put in that nobody wants is perhaps kind of the fastest way to waste $1 billion.
It's interesting the direction that we kind of went with that question, and then we've got a lot of great questions coming in, so I'm going to try to synthesize and ask a few of them. But you really hit on something at the end that I see in one of the questions that I wanted to touch on is, what is hard about this work? I mean, sometimes we talk about what's exciting, and I'm just as guilty of that. It's space. I love what I do. I love what the people that I know are doing. It's so exciting to talk to folks like you and hear about the amazing things that these projects can do. But we don't want to paint a picture where we don't talk about, like, this work isn't simple. There is some technical side. There's data access that we just talked about, but there's a lot of other things. And so, Andrew, maybe back to you. What do you think some of the challenges of your? Jana just talked a little bit about capacity building. Would you agree with that? What would you add?
Yeah, I think Janet's point is exactly right. And maybe just to draw a picture in people's minds, we are living through a moment which is very exciting if you are living on a certain part of it, where the technological capacities for producing high resolution in both time and space and spectra, like really, really high resolution data, high value information, is exploding. So that's growing at a geometric rate. The institutional capacity to absorb that information at the kind of Ministry of Health level isn't changing much at all, right? It's not like suddenly, because there are these exciting things happening in the space industry or the remote sensing industry or the artificial intelligence or cloud computing industry, all of which are connected. Just because we're producing that information doesn't mean that the institutions that could best use it suddenly have developed the capacity to do so. So I think we have to work sort of both sides of the equation. We have to make strategic investments in the absorptive capacity of the health system to utilize this data. And it's not just an example of doing it once in a while. For example, we can monitor land use change for doing biosurveillance for looking for potential areas of emerging risk of novel zoonotic illnesses. But if a health system can only look once a year and we can produce it once a day, right? There's a challenge not just in the ability to absorb, but then to act on that information. So that there's a whole set of downstream changes that may come slowly, because the velocity of information, it both limits the rate of action, or it can potentially accelerate the pace of action. And so there's both exciting and it's challenging. And I think the other side of that story is that it points to a signature thing that we have to do both collectively, and those of us who are involved in producing this kind of information need to do really specifically, and that is relentlessly focus on its access and ease of use, and especially its ease of use. I mean, I will say to you, like Philippe, I love the dashboard, right? I think it's like really, really powerful to see real-time information systems. And we live in a world where we have varying levels of organized federal political support for action. So, you know, like that kind of information is unrefined social power. It's equity, it's social equity, as long as it's understood. But I think the degree to which people even understand spatially explicit information, and, you know, georeferenced information, is quite low. So the ways in which we can help people really understand and do sense making, not just present the information in a way that's accessible to experts, but present it in a way that's accessible to everyone, I think is a principal design challenge. And I think it's the part of this that as the volumes of data and as the quality of information and as the ability to extract insights and indicators from that information accelerates, it's the place where I think we have the biggest gap, because it will drive greater utilization and it will augment the relatively limited lack of resources that are sitting in the health systems today.
Philippe, what about in your work? What are you finding to be some of the biggest challenges that you're facing, and how are you overcoming those?
Thanks, and also thanks for the mention, Andrew. I would say capacity building is one of the main challenges, and also convincing people who are really used to rely on local data sets, sensor-based data sets, administrative records data sets, and convincing those people to use Earth observation sources is sometimes challenging. Obviously, there is always a trade exchange between accuracy or temporal resolution, spatial resolution, and those are challenging. It's a challenging process. However, in building a partnership with institutions like NASA and MIT, I have to say that helps a lot in terms of when you get to a local partner and say, "Oh, we are doing this in a partnership with NASA," everyone opens their eyes really big. Oh, that sounds interesting. How is that being done? So we are always trying to develop everything that we have with partners, be them international or national, local partners, which is really important. The challenge of capacity to deal with this kind of data is a big one, and also for the users, as Andrew was saying, we have these awesome, beautiful dashboards, but sometimes they have too much information for people to understand, and you also have to have more simple visualizations of the information. So the capacity for the people who are using the information and also for the people who are generating is a really small group doing this kind of work in the city of Rio de Janeiro. And obviously, we are much of our work in the partnership with NASA, for example, and also with MIT, is to navigate between these different scales. And when we were doing a super local, for example, a landslide model to be operational. For example, what we did was NASA's global model uses their GPM data, precipitation data, mapped by a mosaic array of satellites. And we, due to the latency of that information, mainly not only the spatial resolution, but also the temporal resolution, for the model to be local and operational, we stopped using the satellite data, and we are now using rain gauge data from the city, so that the model is quicker in its results and can be used in an operational manner. So there are always trade-offs in every source of data set, So I would end saying that one of the challenges that we have, everyone has, is to know exactly what is the potential of every data source that we are using, and the limitation, there are limitations also, and use it accordingly. Because we see lots of people using information to generate knowledge that well, it doesn't match. You are sometimes comparing apples and oranges, as we say. So I guess overall that would be my contribution.
Thank you. I want to try to, we have about 10 minutes left, so I want to try to get through a couple more questions. So we'll try to do a bit of, not quite rapid fire, but I do want to hit and combine a few. And so one that's been around and has gotten upvoted quite a bit is about ethical concerns. And several of you touched on this a little bit in your presentation, but I'd like to return to it and just say, what are the ethical concerns in terms of, your cross comparing data sets in terms of privacy and security that your organizations consider when using Earth observation for SDG 3. Janet, I'd like to start with you if we could.
Yeah, I think like most technologies, it can be used for good or good for evil. What we think about is principally kind of what is the counterfactual, what would be used instead of Earth observation data, and that's sort of a good starting point for understanding the ethical concerns. And so I think one example that Andrew gave you that we also wrestle with is mobile phone and electronic health record data is often what will be used instead of satellite data. And we sort of believe that the privacy and security of those other forms of data are worse, that they could be traced to an individual, whereas Earth observation data can't as easily. That doesn't mean that there aren't going to be opportunities for Earth observation data to be misused. I'm sure there are. And, another great example, I would say from our Nigeria polio example too, the counterfactual, as I showed you, it was a hand-drawn map, which was entirely inadequate for what we needed to do. And in particular, actually, what we found were there were settlements that the government just didn't know about. They didn't know that those people were there. And in the use cases that we've seen so far, Earth observation data has been a very powerful way to actually hold to account governments that might, it's more, I think, a negligence or just a not knowing, but it is sort of an indisputable way to say there are people here that are not being served and have been consistently missed over and over again. And it actually ends up providing in some sense, a very indisputable way to counteract some traditional notions of what the government has been doing. So in some sense, I think to date, what we've actually seen is that Earth observation data has been better than the alternatives, and in some cases has actually been a tool for anti-corruption. That being said, it's as we've seen in many technologies, it's in its nascent stages, and it's not sort of widely used yet. And I certainly, I think, have concerns from sort of watching other technologies mature, that as more adversarial parties understand their utilizations as well, that they will be used for things like population control and identifying where people can move, restricting population movements. And I think we all have to be vigilant about that reality.
Thank you. Andrew, what's Planet's approach to this?
Well, my head goes to this quote that I like from the folk singer Ani DiFranco, who said, every tool is a weapon if you hold it right. And that's certainly true here. I think let me just sort of make one general observation and a couple of how we're thinking about this specifically at Planet. So the first thing is we should be careful about not projecting the precise our politics everywhere in the world. Here in the United States, we have a very significant discussion about especially privacy rights. And you could see them very powerfully in evidence in conversations about contact tracing. And when Apple and Google got together and decided that they were going to use some of this sort of Bluetooth technology to determine where people might have been in proximity to people's cases to accelerate it, you saw real consideration there. In other parts of the world, the predominant political concern, privacy matters, no question, and never goes away, but inclusion may matter more. That is to say, if I'm not on the map at all, I'm not getting access to services. I don't get access to the kind of support. And in a world where we're all enmeshed, even those of us who are remotely, not being on the map not only affects the people who aren't on the map, but it could affect the people who are on the map. And so it's critically important that we think about the balancing test there around privacy and inclusion and what people are asking for. Regardless, however, I think let me just say a word or two about how Planet thinks about this. We are coming of age as a significant technology organization in an era after Facebook and an era after some large organizations got large in part by being able to neglect some of these questions. And so we have a very, very robust ethics program at Planet. I actually chair an independent ethics committee that's completely independent of who we transact with, completely independent of sales or any of those things, and where we look at the ethics of how our data is used, and we use some very standardized formulas for creating ethical case review, where we look at the actor, the particular area, the specific use case, and the consequences of not engaging. What would be the potential downside risk? So we have some counterfactual thinking that goes into our ethical review. We look at, among our more important ethical principles is a do no harm principle or a harm minimization principle. So we're actively looking at places where our data could be used for malevolent purposes. We make independent recommendations to the rest of our executive team and our CEO and to our board to make decisions. And we publish all of those transparently inside of our organization, and we summarize them externally. We also publish announce a code of ethics around this publicly, and we use the same standards internally as externally. And the last thing I'll just say is that data ethics here is not just about the sort of practical processes of cases. It's also about creating the technologies themselves. There's no such thing as a neutral technology. Every technology embeds a code of ethics or expresses a set of ethical principles. The question is whose ethics are being expressed. And so you need to think about that from the actual technologies, the hardware and the software and the sort of business operations and the concept of operations that you use. And you have to embed it in your culture. So we do a whole bunch of work inside our organization to ensure that everybody can sort of flag a case for review, regardless of where they sit in the organization. And we adjudicate dozens of cases actively that are coming in from employees who are saying, I'm not sure about this, or I've noticed this thing over here. So it's a much larger set of processes to do it right. And we will not do it perfectly, but we are trying really hard to do it well.
Thank you. That's a really helpful insight into how a data provider is looking at this issue. We only have a couple minutes left. I'm going to do a super rapid fire round. We've got a lot of questions from people who are asking, how can I get started? Maybe I'm a science teacher, maybe I'm a small organization, maybe I'm a healthcare person who's still learning how this data might be helpful to me. I think there's a lot of different ways of approaching this. And so I was actually wondering if everyone could just cite, say, maybe one resource or website or thing they find interesting. You've already done this a little bit that might lead someone to get more information. So Philippe, how about I start with you? Is there something that you might point people towards?
Yeah, that's a very important question, since we also want to increase the user base of such kind of information, which has so much potential. I would say in our case, we own data.rio for information on the city of Rio de Janeiro. There is some information that are being generated by EO. But in a more general approach, I would say that the NASA ARSAT trainings, they have very good information, and for teachers they have also the Earth Observation for Kids collection, which has awesome information on, for example, urban heat islands and how to monitor that with satellites. That's something we also did for the city of Rio de Janeiro that also has an impact on people's health, the extreme heat. So it's another example that I didn't have the time to mention. So I would say Data.rio and NASA RSET, they are interesting online tools.
Great. Andrew?
I want to say there are amazing public resources. There's exceptional volumes of and access points for public data resources that come from all the major space agencies and other actors. But I will point to just one thing. Planet has a policy where you can sign up if you're an educator or a researcher, you can sign up for free. And we have thousands and thousands of both academic research teams, individual investigators and researchers, and even high school teachers and even some primary school teachers who use this data in the classroom. And if you go to Planet's website and look for education and research, you can sign up, and within a matter of about 15 minutes, you can be downloading data. We don't provide huge amounts of it, but enough for you to get started, to get facility and get comfort with it. And there's a really effective way of sort of navigating around and essentially sort of purchasing satellite, not purchasing it, but accessing satellite imagery as if you were purchasing it like in a shopping cart. You literally just sort of drag images in and hit a button, and they're delivered to you in a few minutes later via email. So for anybody who's interested in getting started, the barrier is zero. You can start today.
Thank you. And Janet, what would you point people towards?
Well, I mentioned Grid3 and WorldPop and Serco Foundation, but I'll give you one more, which is Resources for the Future. And so Crystal and I and another investigator, Mariel Borowitz, will actually be writing up the polio example I went through today, but they have a wealth of different case studies on their website, and they're all sort of very well written up on sort of specific examples of how satellites have improved various sort of social problems. So I would encourage everybody to go there.
Great, thank you so much. And that's pretty much all the time that we have today. I do want to remind everyone that I do want to point out, we also had a poll. I didn't end up coming back to it because our speakers convinced everyone that the data was useful in all of the ways. And so I wasn't sure that we'd have a lot of commentary there. But just to thank you all so much. This conversation was incredibly illuminating and really could have gone on for a long time. And I really hope that this is just the start. We've all seen how incredibly important these topics are right now, and is really something that we're all paying so much more attention to. So thank you for your work. Thank you for your time. Thank you to the audience for their participation. I would also be remiss if I didn't point out that we have 2 final events in this series that are coming up. The next one is going to be on SDG 8, Decent Work and Economic Growth. And the final one will cover all of the SDGs in terms of indicators, monitoring, and evaluation. And if you're interested in any of our earlier topics, they're all also available, the recordings on the website. So thank you to everyone, and we look forward to chatting with you next time.
Thank you so much. It was great. And thank you, Crystal. You're terrific.
Thank you.
Thanks,
Yeah.
guys. Bye.
It was a pleasure. Thank you. Bye-bye.